Katy, it's possible to have two thoughts. One, that murder and taking human life is wrong, that we can have sympathy for a father of two sons, and also to have a thought that being denied health care, as repeatedly happens in this country, for cancer treatment, for heart disease, for diabetes, is causing great anger, justified anger around America, and that we need to fix that broken healthcare system. We need to hold private insurance companies, hospitals, pharmaceutical companies accountable. We need to fight for Medicare for all, or at the very least, fight to make sure that doctors' prescriptions are getting filled or their treatments is getting filled and Medicare would cover it.
You know, what I found so interesting about this story is that there were some out there that were trying to blame one political side for the rage that we're seeing online. They were trying to argue it's a bunch of Democrats who are going online and cheering a shooter and raging against the system. And we saw this from a couple of right-wing media hosts. And the comments under these episodes, these podcasts and whatnot, were from just a torrent of people all across the political spectrum saying, you don't understand what's happening here. This is not about whether you're a Democrat or a Republican. This is about Americans, by and large, hating the healthcare system, because Americans, by and large, red and blue, have had a bad experience at one point in their lives, maybe at more than one point, with this healthcare system, that it's not a red and blue issue. It is an up and down issue. It is a very, very wealthy and everybody else. The very, very wealthy who don't really have to worry about it, and everybody else who has to fight with the healthcare industry to get basic coverage on, it seems like, every appointment or every bill. Given that, have you heard any desire among your colleagues in Congress across the board to really address this, to do something about this systemic issue that so many Americans are fed up with?
Well, first of all, Katy, you're absolutely right. Bernie Sanders, I still remember when he went and did a Fox town hall and talked about Medicare for all, got huge applause from a largely Republican and independent audience. So this is about all those folks who can't afford concierge medicine. It's even people who have insurance, and they routinely are getting their claims denied. The reality is, even if we haven't built the consensus for Medicare for all, which I think is the solution, you can do simple things: cap out-of-pocket costs, require private insurance to cover any claim Medicare would. There are progressives who are pushing for this. I hope it could be bipartisan. One question I would love, one of the right podcasts, to ask Donald Trump. 20 years ago, he wrote a book where he said that he is for the Canadian healthcare system. I think he understood back then how broken the system is, and if he really cares about working people and middle-class folks, will he fight for what he said was the best system?
You know, I want to actually get a little bit further with you on the fixes that you mentioned, because I think there are people out there who would like there to be a better system, but are still wary of a system like the Canadian healthcare system, or like some of the systems we're seeing in the UK, where some people experience long waits for things like CT scans and are frustrated by that. And there are people who want better health care, but who are worried that giving up private health care is going to mean worse coverage across the board. So you're saying, is there a way to fix it from within? Is there a way to make sure that private insurance does a better job at covering people?
Absolutely. First of all, just on Medicare for all, you still could have supplemental private insurance. And the reality is Medicare would make every doctor in network. And unlike Britain, you'd still have private doctors and nurses. It's just that everyone would be covered on Medicare. But short of that, because we can't just overpromise. I mean, every time Democrats get up, they're saying Medicare for all. That's a long-term fight. Why not at least have a simple law that says if a doctor prescribes something or says that you need some treatment, and if Medicare would cover it, then the private insurance companies should have to cover it. You know, Katy, we have 1.4 million people in this country who are employed to determine whether to deny claims, and we only have 1 million doctors. That statistic should show how broken the healthcare system is.
Another topic for you. You have said that you'd be interested in joining DOGE, that government group that is going to be led by Vivek Ramaswamy and Elon Musk, the Government Efficiency Group. Why would you want to join it?
Well, I'm not wanting to join the Doge caucus unless there was a commitment made on no cuts to Social Security, Medicaid, or Medicare. But on some issues, like cutting defense contractors and having more competition to the five primes, Democrats should be open to working with Elon Musk and others if they actually are for reducing a bloated defense budget. We should be for actually reducing waste and keep an open mind in having that conversation.
What about this news from Elizabeth Warren, back to healthcare, about Dr. Oz? She sent a letter to him on Tuesday asking about the advocacy that he's made for the elimination of traditional Medicare, and also asking about his deep financial ties to private insurers. I believe one of those insurers was United.
Well, I think we need to be asking those questions, but ultimately, more than going after a person, and obviously those should be in a confirmation hearing, what the American people want to know are, what are your solutions? How are you going to help my family when my claims are being denied? How are you going to help save me from out-of-pocket costs? Let's deal with medical bankruptcy, eliminating medical debt. Let's figure out how we get more claims actually covered for American people. Let's figure out how we lower out-of-pocket costs. I mean, yes, we have to fight on the nominations, but one of the disconnects with the Democratic Party is we're somehow so focused on fighting within Washington, and people say that their lives aren't getting better. We've got to focus on people and how we're actually going to improve their lives.
All right. Congressman Khanna, appreciate it. Thank you for joining us.
Thank you.